Welcome back, everyone. Great conference today. Next, we have Regen BioPharma Inc. Trades on the OTC Pink sheets under the symbol RGBP and is a biotech company focused on developing innovative treatments using autologous cell therapies, RNA and DNA-based immunotherapy, and small molecules in the immune-oncology and autoimmune disease space. Please welcome David Koos, President and CEO, and Harry Lander, Senior Scientific Consultant. Welcome back, gentlemen.
Well, thank you very much, Anna. So today we have a limited amount of time. So my goal is to cover a little bit on what we're doing on the funding side of things. And then I would like to have a dialogue back and forth with Harry about some recent intellectual property that we filed a patent application on. So I think without further ado, we will move that forward. So I think the last time we were on, we covered the S1 and how it was priced way above what the market is. And so we didn't see a lot of success with that. Since that time, I've spent numerous days trying to identify directions that we can go that will be the least deleterious to our shareholders and provide capital to move our science forward as rapidly as possible. So in that area, one such thing that I'm looking at is really doing a Reg A offering with the idea in mind that unlike the S1 registration, my understanding is that during this process, we can communicate important information to people without being in a quiet period. I need to definitely verify that with our counsel, and we'll see. That may be a direction that we go. We're looking at a couple other possibilities. But the biggest thing is I don't want to see the shareholders get hurt in whatever direction we go. So we've taken some time to look at things. We've kind of narrowed down our short list and people that we think we could do business with. So I think that we'll have more on that probably at the next conference, and I'll be able to spell out things a little more clearly. Since that time, we've also filed some intellectual property that's very fascinating because we stumbled across a couple of things that suggest that we may have unlocked the key to some therapy. Albeit this will be on the immunotherapeutic side, autoimmune therapy, as opposed to the cancer therapy side. But it's very important, and it's a huge market for us, potentially. So Harry, I'm going to go ahead and let you give us an overview. And then at the end, if we have time, we'll try and take in as many questions as we can.
You bet. I see we have about 7 minutes, so I'll try to go a little fast. So that's right, David. The IP that we filed is designed, it's sort of the opposite of an anti-cancer drug. It's an anti-autoimmune drug, but focusing on the same target. So as you know, as many of you may know, we have focused on NR2F6 for many years. And it's clearly now a well understood checkpoint inhibitor, immune checkpoint, and inhibiting that creates an anti-cancer effect. And we have some intellectual property we filed suggesting that if we increase NR2F6 activity in a T cell, we can, in a particular type of T cell, we can suppress autoimmunity.
Oh, okay. So what do you feel the reasoning behind us filing this patent application?
Right. So I think, I often think of a big part of Regen is its NR2F6 portfolio, right? And we have, I think, a strong portfolio for NR2F6 inhibition. But again, asking that question, what happens if you activate NR2F6? It should do the same thing, right? The opposite. It should suppress T cells. Now, what if you do that, but not in any T cell, but in regulatory T cells, which are new, not a new cell type, but it's emerging commercially as a very interesting cell type in cell therapies.
Can you describe the drugs that this patent application will enable?
Yeah, so the idea is that we're creating chimeric antigen receptor T cells, but not T cells that are used to treat leukemias or lymphomas. In other words, the cytotoxic T cells, but just the opposite. They're called regulatory T cells. And the idea is that we will target these T cells to specific autoimmune disorders. And the goal is that to create a set of these regulatory T cells that home in on specific autoimmune targets and then can shut down inflammation locally. And it's well understood that this is what Tregs do, but here we have a way of creating them and targeting them.
Okay, so once we create them, what our therapy involves is really kind of jump-starting those T cells into performing the activities that we want them to perform.
That's right. Yeah. So these T regulatory cells, they suppress the immune system normally. They keep your body from having autoimmune reactions. But let's say you have type 1 diabetes. Which is typically a autoimmune disorder in which your body is destroying your pancreatic islet cells. So what if you took these T regulatory cells that we create that are extremely focused and can focus, let's say, on the insulin receptor? They can home in on the islet cells in your pancreas and completely suppress inflammation or autoimmunity and preserve your islets. So that would be an obvious target. It would take a little bit of research to get there, but it's a clear pathway forward in my view.
So that's one area. Do we have other targets in autoimmune disorders that we're also looking at?
Yeah, I mean, the nice thing about the field of autoimmunity is that there are many well understood targets. So, for rheumatoid arthritis, for example. So there are many types of, and these are giant markets. I mean, we're talking, tens of billions of dollars, these markets. So many people suffer from autoimmunity and much more than cancer. And it's a very active field. So yeah, there's no shortage of targets. The key is that we can activate NR2F6 activity within the cell.
So this shows a lot of promise. Are there other companies working in these areas as well? Yeah,
there was a recent AstraZeneca executed a deal with I think it's Quell Therapeutics, $2 billion, not up front, about $80 or $85 million up front, but that could pay out a couple of $1 billion if their drug makes it to the market. And Quell is a preclinical company like ours, and so but it shows you those kinds of deals. When big pharma is making those deals at the preclinical stage, they're clearly very excited about the technology, and they like to outsource this stuff. They don't do this in-house.
So typically, it seems like it's pretty much routine that large pharma would prefer to acquire companies that are operating within a niche, as opposed to developing a drug internally. Is that a true statement?
Yes, I think they typically do it in stages. So early stage companies, they'll like do a deal like this where they give an upfront payment and then royalties on the back end if the drug hits certain milestones, and then if the drug makes it through phase 3, then they will often purchase the company. But they like to pay more later than pay less early on.
Okay, so we're in a situation then where if what we have discovered, we probably will want to do some sort of confirmatory research to verify what we've found at this point. And moving that forward, we could be one of those companies that potentially attracts the eye of someone that's a large pharma company that wants to get in a space that we've identified as a viable direction to go. Would that be a fair statement?
Yeah, I think that's why having a strong patent portfolio is really important. Getting out there early, protecting it carefully with good patents and with good data is key.
Okay. So I think that, by the way, how many patents have we gotten, and how many patent applications do we have on file? Do you have? I think it was like 15 patents and 11 applications.
Yeah. I think it's the reverse. I think we have something like 10 or 11 approved patents and something like 12 or 15 submitted patents.
So that's pretty substantial when you look at a lot of companies at our stage in development. To have that much intellectual property patent protected is huge.
Yeah.
Okay. Well, I think that's the brief overview for this time. I don't know how much time we have left. I forgot to start my stopwatch. But I'd like to open it up to questions, because I'm sure we have people out there that have questions they'd like to see addressed. Yeah. And I would like to do that with you.
We've got a few questions for you. Mike Smell says, after the reverse split, a big part of the reason was an uplist. So what is the status of this, and what will you do to regain confidence amongst the shareholders?
Okay, so the uplist for us, we've still got some milestones to check off the list before we go there. We've got to increase our balance sheet, and we still have a few convertible notes to get rid of. And it's moving along. It may not be moving along at the pace that the investors and shareholders would like to see, but it's moving along at the pace that we can move at this particular juncture. But I am looking at ways to address those issues.
And Kim Pittman asks for you to talk about your current patent portfolio and how this application will complement it.
Okay.
Sure. Can I grab that one, David?
Yeah, please.
So the portfolio is not entirely focused on NR2F6. I would say it's majority focused on NR2F6 and has very strong, again, I believe, strong patents on issued patents on composition of matter, patents on inhibiting NR2F6, focused on that cancer pathway. But now having a way to activate NR2F6, and we have some small molecules for which we already have patent protection that activate NR2F6, but in this type of concept, you would want, and that's one of the reasons it's so exciting, by approaching it through a more genetic approach, using siRNAs or other methods, you can focus it on the cells that you want. So rather, when you take a pill, the pill is going to go essentially all over your body, the drug. Here, with cell therapies, you create these T regulatory cells ex vivo and then infuse them, similar to what's done in the CAR T space. And so you can have these very focused drugs, but they're not small molecules, they're cells.
Now, let me jump in there really quickly. Is it possible these cell molecules at some point could be turned into small molecule therapies?
Possibly getting the specificity of the small molecules to target, let's say, these T regulatory cells that we're targeting in vivo. it's interesting. It's an approach. I'm not sure how we would do it. Anything's possible, but I think using the genetic approach is at least initially is probably the best way to do it.
Okay, I'm just throwing that out there. What how much time do we have left? And B, do we have other questions?
Yeah, we do. We've got just a few more questions for you. Lee Bautista asks, are you approaching any majors for potential JV that includes funding?
Well, I think right now, it may be a bit premature for me to discuss that. Now, it doesn't mean that we aren't, and it doesn't mean that we are. It means that it's not good to talk about it right now.
Okay. And Keegan Scar wants to know any update on the interesting results from the last conference?
Any updates? Well, I think we mentioned this, we alluded to this patent application we were going through, and that's extremely exciting to us because it really represents, I think, groundbreaking news from our standpoint.
Yeah. This application that we filed is a direct result of those findings.
And Christopher Hanscom asks, what's the expected time frame for the second CRO confirmation?
I think we should have something nailed down here fairly shortly, and then I don't know the actual confirmation research. How long do you think that takes, Harry?
With the funding in place, it would take I want to say 4 months or something like that. The nice thing is in our patent application, although we put those initial findings in this patent application, we also have additional methods in that patent application. So in case the second CRO comes up with something different, the idea is still protected.
Wanted to cover our bases and make sure that we've got some possibilities addressed.
And the last question for you guys from Greg Giordano, will a Reg A offering put pressure on the stock? And how long would a hold be before the stock can be traded?
Typically a Reg A, it's not considered registered stock, it's considered qualified stock. Typically the SEC does not like to see this stuff flipped. However, it is freely tradable. Can be typically most brokerage firms out there will take Reg A stock the same way they would take registered stock. The idea is to do a small Reg A first to make sure that we're not hurting the market. So by small, thinking in terms of maybe 100,000 to 200,000 shares, with the idea in mind that shouldn't be difficult to get absorbed into the market when it is sold, as opposed to on the S1 registration, we were talking about 1 million shares potentially, which would have had a bigger impact on the market. It should hardly be felt.
All right. Well, thank you, gentlemen, for this update. We look forward to seeing you again in the future.
We appreciate the opportunity to talk to our shareholders and potential investors.
Wonderful. Thank you, guys.
Okay. Bye.
All right. That concludes our conference today. We have had a stacked day with so many interesting companies from around the world. Thank you so much for watching day one. Stay tuned for day two tomorrow, starting at 9:40 Eastern. We'll see you tomorrow.